So today topic of discussion is chemistry of lipids. So you already know that lipid is the major several functions in the body. That it is also a stored energy forms in the body in the form of adipose tissues, and it is utilized whenever person is going to be on fasting, on starvation. Okay, so if we see the definitions of the lipid, what is lipid? Lipid is something organic molecules which are soluble in organic solvents and insoluble in normal solvents like water. Okay? Lipids or triglycerides, example are tripalmitin, second one is waxes, beeswax, lanolin, other waxes, cholesterol esters, retinol esters. All of you just kept in your mind the example of both these classification molecules. Because question is asked in the university exam or in the class test, give the classification of the lipids with example. Understand? If you skip to write the example, you are not getting the full marks. Okay? The uses of these waxes are in cosmetics industries for the preparation of different cosmetic products. Uses of this waxes like beeswax, lanolin, cholesterol ester, retinol esters you already know for the drug formation related with the ophthalmic. Okay? These are the structure you know that 3 carbon molecules which contain fatty acid chain. Fatty acid chain. Students, if you see the structure, if you remind the structure in your mind, you usually classify all the lipids. What I say, this is the primary molecules of lipid structure. Primary molecules of lipid structure, that is glycerol plus fatty acid. Glycerol plus fatty acid. What is glycerol? Trihydric alcohol group. Trihydric alcohol group. It contains 3 carbon molecules with alcoholic group containing, with attachment of fatty acid, with attachment of this fatty acid, it's become formation of TG. We call it triglyceride or triethyl glycerol. And these form become stored in the adipose tissues. This is very important. From the chemistry section up to the metabolism, all these are very important because if these molecules become breakdowns, these glycerol molecules separate out and all the fatty acid chains become separate out. Understand? So these are the examples of simple lipids that it contains glycerol plus fatty acid chain. Simply alcohol. The difference between that is if fat in liquid state is called an oil, vegetable oil like groundnut, mustard oil and corn oil. Now complex or compound lipid. As the term you read, that already means there is a conjugation. There is some chemistry between some lipid molecules and other molecules. Okay? Esters of fatty acid with alcohol containing additional group. According to the type of additional group, phospholipids, glycolipids, lipoproteins. Means the first primary molecules of this compound lipids are fatty acids, glycerol, and there is the attachment of secondary group. Like phospholipids, what is the meaning of phospholipids? There is phosphoric acids are present. Glycolipids, there are carbohydrate moiety are attached with the lipid molecules. Second one is lipoproteins, that is proteins molecule are attached with the lipid molecules. Okay? Now phospholipids, additional group is phosphoric acid, they also have natrium containing bases. So on the basis of the first you listen what is phospholipids, that it contains, as the term you listen you already make a concept in your mind that it contains phosphoric acid, fatty acid and glycerol molecule. Okay? After that, the additional group is attached with that, that is glycerol and sphingosine. Glycerol is another type of alcoholic molecule. Glycerophospholipids. Sphingosine, sphingol, nitrogen containing alcoholic group, sphingosines. When these molecules are attached with the phosphoric acid, what is formed? Sphingospholipids, glycerophospholipids. Okay? Now, the example of glycerophospholipid is what? Phosphatidylcholine, lecithin, phosphatidylethylamine, phosphatidylserine, phosphatidylinositol, lysophospholipid, plasminogen, cardiolipids. All these are very important lipid fractions molecules. Generally asked in your viva, what is the function of cardiolipids? What is plasminogen? We read functions. Okay. We also discuss the function of both the molecules. Phosphatidylcholine, that is lecithin, and phosphatidylethylamine. So what is the same between that? What is same between all of these molecules? These all are the types of glycerophospholipid. First thing. Second one, the common thing is phosphatidyl. Phosphatidyl molecules are common in their structure. Now, sphingospholipids, the alcohol present in sphingosines are sphingomyelins. Sphingosine is the alcohol which is present in this sphingospholipids, and these are sphingomyelins are the examples. Okay? So what we classified in the conjugated lipid? Today we have discussed just the classification. Okay? So firstly, the definition of the lipids, that is the organic substances which are insoluble in water, soluble in water solvent. Okay? Like benzene, ether and chloroform. These are the definition. Now the classification on the basis of their structure. The first one is simple lipids, second one is compound lipid, third one is diet lipids, fourth one is miscellaneous lipids. Okay? Simple lipids, what the esters of fatty acid chain with alcohol. Okay? These are classified of neutral fats and triacids. Easy. Second one is compound lipids. In the compound lipid, what we have discussed? We discussed about phospholipids. So on the basis of group present in the phospholipids, we can subdivide it into glycerophospholipids and sphingospholipids. Okay? Now glycolipids. As a term you listen, the glycolipids, that means it contains carbohydrate moiety attached with that. Okay? Lipids contain fatty acid, alcohol, sphingosine, additional group is carbohydrate. Additional group is carbohydrate. They also have nitrogen containing bases, they do not contain phosphate group and also called glycosphingolipids. Glycosphingolipids. Student, on the basis of that terms, you easily understand that it contains carbohydrate moiety, it contains alcoholic group, and it contains fatty acid chain. That's why we say glycosphingolipids. These are adipocytes and gangliosides. In the side of both these fatty acids are generally present in brown fat tissues in the central nervous system. Okay? And gangliosides in the neurons. This is very important, and some of the related disease we discuss in the next. So now lipoproteins, additional group is proteins. I think there is no rocket science to understand. Lipoproteins we can divide it chylomicron, VLDL, LDL and HDL. How can we divide it? Chylomicron, VLDL, LDL, HDL. A simple lipid molecules, simple lipoproteins. Anybody get the answer? How can we divide these lipoproteins on chylomicron, VLDL, LDL and HDL. Anybody else? By homogenization process. Homogenization process. You know what is that? Simply separation. We take the lipid molecules in a test tube and rotate it in revolution per minute. So what is that? On the basis of their masses, we can separate out on different layers. On the basis of this is the test tube, and we take a common lipid molecules and we can go homogenization process, or we easily say centrifuge our molecules. So here we get different labels on the test tube, and on the basis of density we can confirm that it is chylomicron, it is VLDL, LDL and HDL. Low density lipoproteins, high density lipoproteins. Okay, and these are very important molecules to assess the lipid profile of the body. Okay, when we go for the treatment of such patients, of cardiac patients and obese patients, we know important to know the ranges of different fractions of these lipid molecules. Okay, that's why it is important. Chylomicron, VLDL, LDL and HDL. So these are also a compound lipids. Now derived lipids. Derived lipids is what we can separate out the group. The group first is simple lipid, group second is compound lipid. From both of these groups, these lipids are come. This is called dry lipids. What is that? Dry lipids. Dry lipid is what? The lipid molecule which are come as a product from group first and group second, it is called dry lipid. Product obtained after the hydrolysis of simple and compound lipid, which possesses the characteristics of lipid. It is fatty acid, steroid, cholesterol, lipid soluble vitamins and hormones, and ketone bodies. Ketone bodies. Okay. These all are what? These all are lipids. Third classifications of lipid. So students, why we consider these in a separate class? Why we consider these all molecules in a separate diet lipids? Because these are separate out from group 1 and group 2. Okay? Group 1 is what? Simple lipid. Group 2 is what? Compound lipids. Okay? But all these molecules possessing the property of the lipids. That what is the property of the lipids? That are insoluble in water and soluble in organic solvents. Okay? So fatty acid, steroids, several hormones are steroids in nature. Cholesterol you already know, total cholesterol. How is bad cholesterol, good cholesterol? Okay. We discuss such functions, all of this. Lipid soluble vitamins like vitamin E and hormones and ketone bodies. We have different ketone bodies like acetone, acetoacetate and beta hydroxybutyrate. All these ketone bodies are important. Now, functions of the lipids, we already discussed the functions, several functions: storage form of energy, structural component of the membrane, cholesterol, a sterol, a precursor of many steroid hormone, that is vitamin D. Sterol is what? What is the meaning of sterol? When we see the structure of the cholesterol, there is a ring present of 17 carbon molecules. This is called sterol. We call this ring CPCC, cyclopentaphenylalanine ring structure. Lipid act as a thermal insulator in subcutaneous tissues. Means what? It can deposit in the adipose tissues and provide cushions to the internal organs. First thing, lipids are important dietary constituent because fat soluble vitamin and essential fatty acids which are present in the fats of natural foods. When we give the classification of the vitamins, it is water soluble vitamins and fat soluble vitamins. So it is important to solubilize these fat soluble vitamins. Which one is fat soluble vitamins? Anybody else? Hey, you last one. Third row. Third, stand up. No. First, second, third. जो पीछे देख रहा है, आपसे भी कह रहा हूँ. Stand up. Give the classification of vitamins. Listen, I am not listening your voice. Say loudly. Give the classification of the lipids. अगर 6th स्टैंडर्ड के स्टूडेंट से पूछा जाएगा वो बताए. Bulk compound. Vitamins. What I say, give the classification. Give only the classification of the vitamins. Water soluble. Good. Water soluble. Second one is. अच्छा, which one is fat soluble? Right. ये गायत्री मंत्र जैसा नहीं बनना चाहिए. BMC से water soluble. वो ठीक. जो पूछा जा रहा है उसका आंसर. BMC water soluble. अभी पूरी ऑक्सीजन ले रहे हो ना क्लास की. सो क्यों नहीं आएगा? ऐसे सिंपल टर्म्स बना दिया था हमने. तो ADE is what? Fat soluble. BMC water soluble. ठीक. अच्छा, which is the source of vitamin A? Very good. Beta carotene. Good. Beta carotene कहाँ मिलता है? So what is the source of vitamin E?
Green vegetables, cotton butter.
No, it is not. There is sunflower oil. Sunflower, and second one is papaya. Good source of vitamin E. Sit down. So now these all are the functions. They will help in absorption of fat soluble vitamins, vitamin A, D, E, K. So these all are the functions. Now we go for separate classes. What is fatty acid? We discuss bad lipids one by one. All of you understand. And this question asked in your exam. Classify what is fatty acid? Classification. Give the classification of fatty acids. Okay? Very simple. All of you understand. Fatty acids are the carboxylic acid with hydrocarbon chain. All you see the structure in organic chemistry? Organic chemistry में पढ़ा था या नहीं पढ़ा था? नहीं पढ़ा था. CBSE बोर्ड को खत्म कर दिया ये सब. केमिस्ट्री में है कि नहीं? Fatty acid CH2 long chain of carbonic molecules. Okay? Carboxylic acid with hydrocarbon chain represented by a chemical formula RCOOH. R is what stand for? Alkaline group. Very good. Alkyl group. And COOH. If there is bond is present, it is become ENE and INE. Lastly. Okay? Fatty acid are amphipathic in nature. What is the meaning of amphipathic? This is both. Now, these are the examples of fatty acid. It is called palmitic acid. It is 16 carbon molecules, omega 16 carbon atom, fatty acids. Okay? Alpha, beta, omega. Now, can you give what is the meaning of alpha, beta, and omega? How will we represent this alpha, beta, and omega? The carbon molecule which is nearer to the functional group is alpha carbon. How stand for beta? Alpha, beta. And what is omega? Last carbon. Okay? Now classifications of fatty acid. Very important. This question asked in your exam. Classification of fatty acid in 4 major classes. Straight chain fatty acid, branch chain fatty acid, substituted fatty acid, and cyclic fatty acid. These are the structure basis classification. And on the basis of consumption, we can divide essential fatty acid, non-essential fatty acids. Okay. Now, with this diagram, we understand that fatty acid, it can give the four classification: straight chain fatty acid, branch chain fatty acid, substituted fatty acid, and cyclic fatty acid. Cyclic fatty acid. Okay. Example of branch chain fatty acids are isovaleric acid, isobutyric acid. Substituted fatty acid, lactic acid, cerebronic acid, oxynuronic acid. Cyclic fatty acid is colmonic acid and prostaglandins. Colmonic जो acids जो आपका लास्ट में जो क्लासिफिकेशन दिया उसका एग्जांपल, these are present in the flower. And prostaglandins is formed by the icosanoids. It is a local hormone. We call it local hormone, but it is formed by the icosanoids. Icosanoid is what? It is 20th carbon molecules chain, which is precursor for the synthesis of prostaglandin. And prostaglandin is very important because it is very important to control several disorders and some physical conditions. Like during pregnancy, to cause the labor pain, we induce some prostaglandins in the body. In the case of fever, there is a role of prostaglandins. When we discuss the synthesis of fatty acids, synthesis of prostaglandins, we all discuss all these roles. Okay? Now, on the basis of present of bonds between their structure, we can divide it saturated fatty acid and unsaturated fatty acid. Even carbon fatty acids, you already know what is the meaning of even carbon: 2, 4, 6, 8, 10, 12, 16. What is palmitic acid? Even carbon fatty acid. Okay? Odd carbon fatty acid, propanoic acid. Unsaturated fatty acids, monoic fatty acid, oleic acid, and polyenic fatty acid. Student, if question is asked, classify fatty acid, define fatty acid, and give the classification of fatty acid, you can make this table only. If the question is up to 5 marks. अगर 5 नंबर का क्वेश्चन आता है, सिर्फ ये टेबल बनाइए. Just you draw simply this table and get the full mark. Don't write the theory. Now, functions of fatty acids. Function of fatty acids. Function of fatty acid is what? The first function is that it is present in the main constituent, structural constituents in phospholipids. Okay, so we call that it is a major component of phospholipids, glycolipids, which is a component of the membrane. Second one, fatty acid drives some hormones like prostaglandins. We call it as local hormones. Okay, prostaglandins. Fatty acids serve as a major fuel for most cell, or basically adipose tissues. Okay. These all are the general functions of the fatty acid, and some more of the functions you read in your books. Okay, some more of the functions. Fatty acid. Okay. So now, if we classify the fatty acid, which one is first fatty acid? Say loudly, all of this. Straight chain fatty acid. Okay. Second one is third one is substitute fatty acid. Fourth one is cyclic fatty acid. Now we give another classification. Which one is? Straight chain. Even or pele? Saturated and unsaturated. Okay? ये पूरा क्लासिफिकेशन है इसका, वही इसका फंक्शन है. Now numbering of the carbon atom you already know that we discuss alpha and beta. किसी को क्लियर हुआ कि नहीं हुआ? Alpha and beta. How can we give the number of? How can we give name this alpha carbon atom, beta carbon atom? From the last bench student, second number. All of you stand. Are you understand what the meaning of alpha carbon atom? What is the meaning of beta carbon atom? What is the meaning of omega carbon atom? From the last year? From this one? Third student from the last bench? Stand up. Are you understand what is the meaning of alpha carbon atom? Huh? Sit down. Now numbering of the carbon atoms. This number starts from the function group 1, 2, 3 up to 6, 16. Palmitic acid. Students, these palmitic acids is not come here. It is comes to next level of the classes. Like give the beta oxidation of fatty acid of palmitic acid. Okay. Palmitic acid. Now representation of double bond, C systems and omega system. There is a numbering type of numbering. Basically, friends, there is the process of representation of this numbering that it contains C18 1 delta 9. What is the meaning of that? C18 1 delta 9. That means it contains 18 carbon fatty acids and it contains one double bond between 9 and 10. That represents C ratio 18, ratio 1, ratio delta 9. That means it contains 18 carbon fatty acid chain and contains one double bond between carbon molecule 9 and 10. Okay? So these are the systems for representation we call as C systems. Okay? Okay? All of you understand? अगर मैं कहूँ इसमें C16 2 delta 3, what is the meaning of that? हाँ? बताइए क्या उसका मतलब होगा? अगर मैं 2 delta 9 कहूँ तो there is presence of 2 double bonds. अगर मैं ये represent करूँ C16 2 delta 9 and delta 7, what is the meaning of that?
Between 19 and 17.
Yes, that's meaning it contains 16 carbon fatty acid chain molecules and double bond between 6 and 7, 9 and 10. Okay. Now second one is omega systems. That terminal carbon methyl group is represented as omega. That is means last one carbon molecules represented as omega molecules. Okay. And it's denoted as oleic acid denoted as C18 omega 9. Omega 9 represents the double bond found between 9 and 10 carbon atom from omega carbon. Okay? And this method is widely used by the nutritionists. So all of you understand what is the meaning of that? What is the meaning of that? That simply means it contains 18 carbon atom fatty acid chain molecules and presence of double bond from omega carbon molecules. And omega carbon molecule is what? Last terminal molecules. From the last terminal molecules, we counted the carbon molecules and we check the position of this double bond, and it is 9. This is the way of representation. Okay? Now you see oleic acid that it contains 18 carbon molecules, and in this chain, which one is omega carbon? You stand up. First one. Say the omega carbon. Which one? From the first. 16. C16. C16 is right. 18. Why 18? This is because it is terminal carbon molecules. Terminal carbon molecules. Okay? Sit down. And here is the first one, it is called omega. Why it is? What?
So because methyl group is present.
Statement.
So because methyl group is present, so we will take omega molecule from methyl group. So that's why first.
Okay. So these are the system. The first one is C system and second one is omega system. Okay. Now, naturally occurring unsaturated fatty acids, it's oleic acid, linoleic acid, and linolenic acid, and arachidonic acid. Unsaturated fatty acid, and we also call as PUFA, polyunsaturated fatty acids. And what the role of PUFA? What the role of unsaturated fatty acid? This is eicosanoids. What I say? These are the eicosanoids, 28 carbon molecules used as a precursor for the synthesis of prostaglandins. Okay? So these are all are the unsaturated fatty acids. Why it is called unsaturated? Due to the presence of double bond in their structure. Due to the presence of double bond in their structure. That's why it is called unsaturated fatty acids. Okay? Now examples of alpha linolenic acid is timnodonic acid, cervenoic acid. All of you write it. All of you write it the example. Don't take the picture from the mobile. Write it the example. Timnodonic acid, cervenoic acid. Linolenic acid, arachidonic acid. Examples omega 6. Omega 9 oleic acid, lactic acid. All these are what? These are the omega classifications of fatty acids with examples. And when the question is asked in your exam, give the classification. You all know all the things you will write in your copy. Okay? लिखा सबने? Now move on next slide. Do it fast, students. We just cover one more topic, essential fatty acid. Write fast. इंटरव्यू मोबाइल यूज कर रहा है? Okay? Fatty acid that are required for optimum health and cannot be synthesized in the body and supplied to the diet. It is called essential fatty acid. Essential fatty acid. अच्छा, which one is essential amino acid? Anybody else? Which one is essential amino acid? What are the mnemonics of essential amino acid? Very good, very good. That will fly. कुछ और दूसरा भी दिया हुआ है? That will fly. So all these are essential amino acids. What is the meaning of essential? It is not synthesized in the body. Essential proteins, essential amino acids, essential fatty acids, all these are the first terms and conditions that it is not synthesized in the body. We take from the outsource, as in the dietary form. Okay? The examples are linolenic acid, linolenic acid, arachidonic acid. Understand? Linolenic acid, how many double bonds are present? Two double bonds. Linolenic acid, how many double bonds are present? Three double bonds. In arachidonic acid, there is a four double bonds are present. Double bond carbon atom beyond C9 in the fatty acid chain. Okay. Now, function of this essential fatty acid, I already tell you that it is a precursor for the synthesis of prostaglandins, and we called as eicosanoid essential fatty acids. It is act as a prostaglandins, thromboxanes, and leukotrienes. Okay, these are the synthesis of eicosanoids. So all these are essential for the synthesis of prostaglandins, for the synthesis of thermoxanes and leukotrienes. These are the function of different leukotrienes and thromboxanes is what? It is helpful in blood clottings. Okay, when you discuss the blood clotting factor, there is a separate function of thromboxanes, leukotrienes. It is inflammatory markers of the body. Okay, maintenance of structural integrity, development of retina and brain. There is DHA. Generally, DHA is mandatory for the small child in their diet for the development of brain. That is docosahexaenoic acid. Neonatal period, during the neonatal period. That's why we say some pediatrics, good pediatricians suggest DHA diet. Okay, and these are become skin protector, and these all are the functions. And anti-anthogenic effect, that is very important function of that. What is the meaning of that? They provide resistance for the deposition of cholesterol in their blood vessels. Okay, what is the meaning of atherosclerosis? That means hardening of the blood vessels. Why the blood vessels become hard? Due to the deposition of the cholesterol. But these molecules act as an anti-atherogenic effect. That means essential fatty acids can reduce the deposition of the cholesterols in the blood vessel. That's why it is called anti-atherogenic effect. It increases esterification and excretions of cholesterols, thereby lowering the serum cholesterol levels. So ultimately what? They can reduce the chances of deposition of this cholesterol in the blood vessels. What is the meaning of esterification? It is detergent-like activity. Emulsification, esterification, that is breakdown of this fatty acid chain from the triglycerides. Okay. Now, deficiency of these essential fatty acids are generally produce scaly skin, eczema, loss of hair, and poor wound healing. Okay. Impaired lipid transport and fatty liver may occur and decrease efficiency of biological oxidations. So all these are the functions when there is a deficiency of this EFA, essential fatty acids are occur. Okay. Now we discuss this topic in the next class. Okay. We discuss about the functions of the compound lipid, different disorder related with the compound lipids, and all these important properties. Okay. So now after the class you just take a one reading from the book, all of you things you understand. If there is any queries, you will ask to me. Thank you.
Morning everybody. Another beautiful weather in Bolpur. Not too hot, not too cold. So with this beautiful weather, I start about something about related to a demonstration and some oral questions that to be asked in your examination. What are the structures around knee joint? There is no definite in your book, you cannot find these type of headings. But it is very important in certain aspect so that you have got an idea about the relations of the knee joint. And knee joint, you know, is a very important topic. I have already told you. We read actually to gain knowledge, to apply this knowledge in practical field, and last but not the least, to pass the examination. So, knee joint is one of the chapter, not in every year, But every alternate year, some questions come about the of the knee joint. So knee joint is a very important joint even in our body. So we have got some preliminary idea about the relations of the knee joint and clinical aspects about that. You know, knee joint is a joint. I am not talking about knee joint today. Just structures around or structures present around the knee joint. Is a joint along with the lower end of the femur, upper end of the tibia, and also the posterior surface of the patella. Patella is a sesamoid bone. Very often asked, what is the characteristic of a sesamoid bone? Hope you will all know. Sesamoid bone develops within a tendon. It has no periosteum. All are features that I am not going to details because only 1 hour timing. So, it is a complex hinge type of joint. What is hinge? Means your door. Just one axis and usually 2 movements. But knee joint is not a typical hinge joint. It is a modified knee joint. Why modified? Because during flexion and extension, the 2 movements, this is the flexion, this is the extension, there is occurs some rotation, conjunct rotation, automatic rotation. There are 2 types of rotation in our joint movement. One is the adjunct rotation, one is the conjunct rotation. Adjunct means actively by muscle action one is doing. That is the adjunct. And conjunct, automatically the movements occur. Right? Suppose there is an slip in the park. If you put in the higher end, you automatically come down without spending much of your energy. So this is the conjunct rotation. So as there is some rotation also occurs. Normally in a typical hinge joint, one axis and 2 type and movements 2, flexion, extension, axis is transverse. But in knee joint, an axis must be fixed, like a door. Axis is fixed. The main axis in which the movements occur is not moving. But in a knee joint, axis also moves during the movement, number 1. Number 2, there occurs some rotation. During flexion, medial rotation of the femur on the tibia, and during flexion and extension opposite. So we call it modified hinge joint. So knee joint is a modified hinge joint. And as the condyles are there, femoral condyle and tibial condyle, we call condylar joint also. So whatever it may be, just an idea. Now what are the structures around the knee joint? Already you know that in our anatomical term, always we describe the relation in anatomical position, right? Whether the cadaver or the patient lie in the supine position or prone position, lying, standing, it should be described in the anatomical position. For example, if you dissect the popliteal fossa or posterior aspect, right? If we cut the skin, you will find the superficial fascia, then the deep fascia, then you will find the muscles. Now, tell me, the superficial fascia, the skin in the back region, or better to say the superficial, or another word, it will be the semitendinosus. Already you know, hamstring muscle, right? Hamstring muscle, semitendinosus, and this is the, when you going to dissect, you will find the semitendinosus here and semimembranosus under it. Right? যখন dissect করছি semitendinosus and you will find semimembranosus. And my left hand is semimembranosus and right hand is semitendinosus. Right? All of you? Now tell me which is anterior. Semitendinosus or semimembranosus? Huh? Semitendinosus is anterior? No, just the opposite. You put them in the anatomical position. You put them in anatomical position. Then you will decide which is anterior and posterior. So that we call the relations not anterior to posterior, we call it superficial to deep. When it's called superficial means what you find the first time, that is the semitendinosus. Then you will find the semimemnosus, so it is deep. What is superficial? Semitendinosus. Which one is deep? Semimemnosus. Abar bolchi. When you cut, you will find first the semitendinosus. Then you will find the semimemnosus when the patient is in this fashion. Right? So which one is superficial? Tendinosus. Which one is deep? Which one is anterior? Semimemnosus. Clear? এই আইডিয়াটা ছিল না তাহলে তোমাদের উল্টো ছিল সব সময় whatever meet the position, whenever we call it anterior posterior, it should be in the anatomical plane. You have to imagine, কল্পনা করতে হবে anatomical plane এ পেশেন্টটাকে দাঁড় করাবে, then you will divide anterior to posterior. কিন্তু সব সময় we feel some difficulty of this, so that we call it superficial to deep. No question. Whatever you find in dissection, you find first, it is the superficial. When you find under it, it is deep. But if we cut in this fashion from anterior to posterior, then semimemnosus is superficial and semitendinosus is deep. Clear? Clear? So this is the beauty of the relations, understanding the relations of the knee joint. Right? Whatever it may be the case, this is the relation. So when you cut the superficial and deep fascia, then we find the muscles anteriorly around the knee joint. Now we describe the knee joint in anatomical position. So anteriorly we find muscles. What are the muscles? The quadriceps femoris, 4 muscles. Right? Quadri means 4, quadros, Latin word. So there are 4 muscles: rectus femoris, vastus medialis, vastus lateralis, and deep to them, vastus intermedius. All these muscles are converged and attached to the form a tendon, and through the tendon it is attached to the patella. And from the patella, the combined attachment extend as a ligament, as a strong rubber band to attach to the tibial tuberosity, and this ligament is known as the ligamentum patellae. One of the strongest ligament in our body, not the strongest. The most strong ligament in our body is in the hip joint, the iliofemoral ligament. Mone rakhbe. And ligaments are very strong. Sometimes bone may break, ligaments not. So how strong the ligamentum patella? So, and these are all supplied by this posterior division of the femoral nerve. Femoral nerve কি করে মনে রাখবে? ব্রাঞ্চেস গুলি শিখিয়ে দিই একটা, কি বলো? শর্ট কাট অ্যান্ড কোয়াড্রিসেপ স্যাফ, শর্ট কাট অ্যান্ড কোয়াড্রিসেপ। শর্ট মানস কি? এস, nerve to sartorius. Nerve to sartorius. Cut means cutaneous. Two cutaneous. Medial and intermediate cutaneous. So it is the anterior division. And from the posterior division, quadriceps. Quadri means nerve to all the quadriceps muscle. Rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis. Saph means saphenous nerve, a sensory nerve, saphenous nerve. Bas. Huh? Ace kunta? Short, nerve to sartorius. Short mane nerve to sartorius. Nerve to sartorius. Kete means cutaneous, medial and intermediate. খুব কঠিন মনে হচ্ছে আর মনে রাখা? হ্যাঁ, তাহলে অ্যানাটমি কি কঠিন সাবজেক্ট? Is one of the easy subject, right? Anatomy is one of the easy subject in the first prof. Look, read in this fashion, you will get boost up and you can easily remember. Nothing to be afraid of. কি বলো? টেল মি কি এটাকে রিপিট? তাহলে শেষ হবে না তো, অনেক বলার আছে। আচ্ছা, সো টু রিমেম্বার দ্য branches of the femoral nerve. Femoral nerve has got a anterior division and a posterior division. Branches বলতে ট্রাঙ্কটা নয় কিন্তু। From the trunk there are two nerves arises. From the trunk mean main trunk, which is very short. Nerve to pectineus and nerve to iliacus. Besides that, after that, femoral nerve in the femoral triangle it divides in anterior division and a posterior division. Femoral nerve divides anterior division and a posterior division. From the anterior division arises these nerves. These nerves means not shortcut nerves. Just to remember, we give the mnemonic. Mnemonic মানে কি? যেটা দিয়ে আমরা মনে রাখতে পারি। হ্যাঁ, so shortcut means from the anterior division of the femoral nerve there is a two division, anterior and posterior. From the anterior division, two cutaneous nerve and one muscular nerve arises. The muscular nerve is the nerve to sartorius and cutaneous nerve is the medial cutaneous nerve of thigh and intermediate cutaneous nerve of thigh. And from the posterior division, quadriceps means nerve to quadriceps muscle, mean nerve to vastus medialis, nerve to vastus lateralis, nerve to vastus intermedius, and nerve to rectus femoris. And sap means saphenous nerve, one sensory nerve. So these are the coming from the posterior division. To remember, I give a hint: shortcut and quadriceps. Shortcut means nerve to sartorius, short বলতেই মনে পড়ে যাবে sartorius. Short cut means cutaneous, two cutaneous. Quadriceps, don't say quadriceps, you remember as quadriceps, S-A-P-H. Quadri means nerve to quadriceps muscle. Quadriceps is not a single muscle, it is four muscles, so individually it gives four branches. One branch to rectus femoris, one branch to vastus medius, one branch to vastus lateralis, one branch to vastus medialis. And sap means saphenous nerve. So it gives a long nerve to get the sensory innervation from the medial side of the thigh, leg and up to the ball of the great toe, medial side of the great toe, a foot up to the ball of the great toe. So this is the saphenous nerve. So all quadriceps muscle are extensor of the knee joint, clear হলো? নেক্সট আমি চলে যাচ্ছি এবার বলতে পারবে পরীক্ষায় যদি জিজ্ঞেস করে হোয়াট আর দ্য ব্রাঞ্চেস অফ দ্য ফিবোরাল নার্ভ, ফার্স্ট বলবে ট্রাঙ্ক থেকে নেমোনিক নেই, নার্ভ টু পেকটিনিয়াস, নার্ভ টু ইলিয়াকাস মনে রেখে বলতে হবে। দেন ফিমোরাল নার্ভ ডিভাইডস ইনটু টু ডিভিশন, অ্যান্টিরিয়র ডিভিশন, পস্টেরিয়র ডিভিশন। অ্যান্টিরিয়র ডিভিশন মনে পরীক্ষা এক্সামিনেশনে শর্টকাট বললো না কিন্তু, তাহলে কিন্তু মুশকিল আছে। এক্সামিনেশনে ডোন্ট টেল দ্য ব্রাঞ্চেস অফ দ্য ফিমোরাল নার্ভ আর শর্টকাট অ্যান্ড কোয়াড্রিসেপস, ডোন্ট টেল ইট প্লিজ। এক্সামিনেশনে বলবে না, এটা জাস্ট টু হ্যাভ এ ready-made idea so that you can get shortcut. So nerve to sartorius and cutaneous, medial and intermedius. And posterior division quadriceps, in nerve to quadriceps means nerve to vastus medialis, intermedius lateralis and rectus femoris, and sap means saphenous nerve, nerve to saphenous nerve. So, therefore, next question, what is saphenous nerve? Sir, it is a sensory nerve. What is sensory nerve? Means it carries sensation, pain, touch, temperature from the body. What is, bujhle? And posteriorly there are another groups of muscle. You better know that is the hamstring group of muscles. Hamstring group of muscle. Ham means what? Ham means posterior aspect. In old British or Irish, the posterior aspect of the thigh is called as ham. Ham. String means cord. As the tendons are cord-like, so they are called hamstring. Some say the butchered or cut pig, it is hanged from the hook or the string to this muscle, they are called hamstring. Whatever means, ham means posterior aspect of the thigh. Hamburger. Hamstring muscle, already you know, often asked. লিখে রাখো, we don't go or appear in the examination without knowing hamstring. পরীক্ষায় হ্যামস্ট্রিং না পড়ে যাব না, পরীক্ষায় বসবো না তাও বলো হ্যামস্ট্রিং পড়ে যেতে হবে। There are muscles, কি মাসেল হ্যামস্ট্রিং বলো? সেমি টেন্ডিনোসাস, সেমি মেমব্রেনোসাস, long head of biceps femoris. Don't say biceps femoris. Biceps femoris has got two components. One is the long head, one is the short head. Only long head is the component part of the bicep hamstring. Short head is not. And last but not the least, the adductor part of adductor magnus. Again, adductor magnus has got two component. Hamstring component and an adductor component. So only the hamstring component or hamstring part, আমি adductor part কি বলছি, hamstring part of the adductor magnus. Right গেল? তাহলে এইগুলি হচ্ছে hamstring. What are the criteria of the hamstring muscle? একই পড়েছো তো, পড়তে হবে তো, very easy. They must origin, insertion, nerve supply. এইটা তো একটা মাসেলের মনে থাকবে তো, একটা মাসেল যখন আস্ট আমরা কি বলি, অরিজিন কি, ইনসারশন কি, নার্ভ সাপ্লাই কি, অ্যাকশন কি। হ্যামস্ট্রিং এর যখনই ক্যারেক্টারিস্টিক আমি বলতে পারছি না, আই ক্যানট টেল কি আছে, জাস্ট ইউ টেল মি whenever we describe a muscle, we tell him origin, we tell insertion, then the nerve supply, then the action. You will get the characteristic of the hamstring. Origin, all must be originated from the ischial tuberosity. সমস্ত মাসলকে ischial tuberosity থেকে অরিজিন হতে হবে। Insertion, beyond the femur, beyond the knee joint. Any bone of the leg, might be in tibia, might be in the fibula, not in the femur. Insertion should not be in the femur. It should be beyond the, কি বললাম, beyond the knee joint. Or beyond the knee joint বলো না, beyond the knee joint বলো না, beyond the knee. নিচে ইনসারশন হতে হবে। লাস্ট, তাহলে কি বললাম, অরিজিন, ইনসারশন, নার্ভ সাপ্লাই। It must be supplied by the tibial component of the sciatic nerve. Sciatic nerve has got a two, tibial and peroneal, common peroneal component. So this hamstring muscle should be supplied by the tibial component of the hamstring nerve. Action. Sciatic nerve, sorry. Action. They must be flexure of the knee joint and extensor of the hip joint. বাস হয়ে গেল। দিজ আর হামস্ট্রিং। তার মধ্যে গন্ডগোল দুটো আছে। অ্যাডাক্টার ম্যাগনাস, ইসকিয়াল ফাইবার্স অফ দ্য, আমরা হ্যামস্ট্রিং অথবা আরেকটা নাম বলা যায় ইসকিয়াল ফাইবার্স অফ দ্য অ্যাডাক্টার ম্যাগনাস, ইসকিয়াল ফাইবার্স অফ দ্য অ্যাডাক্টার ম্যাগনাস। এটা কি অসুবিধা, এটাকে হ্যামস্ট্রিং বলা যাবে না কেন? কিন্তু আমরা ইনক্লুড করছি, তাই বা কেন? ইসকিয়াল ফাইবার্স অফ দ্য অ্যাডাক্টার মাইনাস অরিজিনে নো কন্ট্রোভার্সি। ভালো করে শোনো প্লিজ, there is a no controversy about the ischial fibers of the adductor magnus because they originate from the medial side of the ischial tuberosity. কোনো ঝামেলা নেই। The insertion is the adductor tubercle of the femur. তাহলে তো নি ক্রস করলো না, তাহলে আমরা এটাকে হ্যামস্ট্রিং কি করে বলবো? The insertion of the ischial fibers of the adductor magnus is in the adductor tubercle, which is present in the femur, not in the tibia, not in the fibula. According to rule, it must be inserted. These muscles must be inserted either in the tibia or in the fibula. তাহলে কি করে হলো? But still it is a hamstring. Can you tell me? Because from the adductor tubercle to the tibia, পড়াবো এক্ষুনি, upper part of the medial border of the tibia, there is a ligament extent known as the medial collateral ligament or tibial collateral ligament. And it is nothing but the degenerated part of the adductor magnus. কি ব্যাপারটা হলো? This is the medial, this is the lateral side. The adductor magnus is inserted here, right? In the adductor tubercle. This is the adductor tubercle. বুঝতে পেরেছো? হচ্ছে না কিন্তু from the adductor tubercle, from the medial border of the tibia, there is an ligament. Known as the medial collateral ligament. Which is in lower primates, lower mammals, it was a muscle. Actually, in lower primates, the adductor magnus is extend like that. In human, this part become a ligament and known as the medial collateral ligament. So medial collateral ligament is nothing but the degenerated part of the adductor magnus. So actually adductor magnus inserted into the tibia, but not as a muscle, but as a ligament. So that we include this adductor magnus as a ischial fibers of the adductor magnus in the hamstring group. Clear হয়েছে? Clear? Lower animal কিন্তু it was a hamstring group because it was inserted into the tibia. In human, it is inserted into tibia, no doubt, but not as a muscle, but as a ligament. Lower part of the muscle is changed, পরিবর্তিত হয়ে গেছে as a ligament. What is the name of the ligament? Medial collateral ligament. Or other name of the medial collateral ligament? Tibial collateral ligament. Or why the short head of the biceps femoris is not a hamstring? Because it takes origin from the femur, not from the ischial tuberosity. Plus, it is supplied by common peroneal component of the sciatic nerve. So, orale jiggesh korbe, do you think biceps femoris is a hamstring muscle? No, sir. Only long head is a hamstring, short head is not. Next question, ami korbo. Why? Then you tell me that the origin is in the posterior aspect of the femur, the lateral edge of the linea aspera and lateral supracondylar line, and it is supplied by the common peroneal component of the sciatic nerve, not by the tibial component. So, biceps femoris, short head of biceps femoris, we cannot include them. So, একটা oral question এখান থেকে answer হয়ে গেল. Next, these are the nerves. You know, this is the হচ্ছে না কেন গো? This is the sciatic nerve, yellow one. Pointer যাচ্ছে না কেন? Battery শেষ নাকি? So, we divide into tibial and a common peroneal component, right? Just below it there is an popliteal vein, and most deep there is an popliteal artery. You know, there is an crossing from এটা পরে পড়বে আর ডিটেইলসে যাচ্ছি না, পাল্টে next slide দাও। And there laterally there is another name, possibly you have no iliotibial tract. আম শুনেছো? A strong ligament, it is found. So, these are the, এই আজকে কি হলো? কি হয়েছে? অসুবিধা কি? হ্যাঁ, গরম লাগছে। এই আস্তে আস্তে টাইম দেখো, অলরেডি 40 হয়ে গেছে। আচ্ছা, এইদিকে তাকাও প্লিজ, গরম ঠান্ডা আমাদের লাইফ। So this is the medial collateral ligament, and this is the lateral collateral ligament. Two ligament attaches femur to the tibia. শর্ট নোটস থাকে, প্লিজ আস্তে আস্তে, এটা কিন্তু অনেক সময় শর্ট নোট থাকে। আমি what I am reading, what I am teaching, only the related to your examination, only to related to the examination. So tibial collateral ligament, morphologically it represents a degenerated tendon of the adductor magnus muscle. I have already explained to you. Explain করে দিয়েছি, বাস। Number 2, it has two parts. Though a ligament, it has got a superficial component and a deep component. One is superficial, one is deep. Actually, after taking its attachment on the femur, it divides into two components. One একটা ভেতরে থাকে, একটা বাইরে থাকে। বাইরে যেটা থাকে তাকে বলি superficial, and ভেতরে যেটা থাকে তাকে বলি deep. Then it attaches to the tibia. and binds the tibia with the femur. The deep part blends with the capsule of the knee joint and, very important, with the medial meniscus. What is meniscus? In between the condyles of the femur and tibia, there is a disc of cartilage, fibrocartilage. There are two, one on either side, laterally lateral meniscus and medially medial meniscus. And this tibial collateral ligament is attached to the medial meniscus. That is very important. You know, in your even careful. In your in your newspaper, you will find this player has got meniscal injury. So in this year also, you got in your final MBBS first prof examination medial meniscal injury esheche kintu. So it is very important, and it is one of the reasons that why medial meniscus is more prone to injury than lateral meniscus. There are other reasons, and it is one of them. The deep tibial collateral ligament is attached to the medial meniscus. Byaparta ki hoy, always there is a movement of the condyle, because we are always walking, running, jumping. So always there occur flexion and extension, flexion and extension, flexion and extension between the condyles of the femur and the tibia, and also in the patella, right? So in between it, there are menisci, lateral and medial. So always these meniscus are compressed between these two hard bony points, right? So there is a chance of injury. And lateral meniscus, and this can be avoided if during when there is compressed, যখন চাপ পড়ছে ওই চাপের জায়গা থেকে যদি তুমি ওকে সরিয়ে দাও একটুখানি হলেও বেঁচে যাবে. Lateral meniscus has got attachment with a muscle known as the popliteus muscle. Few fibers of the popliteus muscle, যদি টাইম হয় আসবো আজকে, attached to the lateral meniscus, right? ভালো করে শোনো এটা. Few fibers of the popliteus muscle is attached to the lateral meniscus through capsule. Lateral meniscus is attached. Few fibers of the popliteus is attached to the lateral meniscus. ভালো কথা. Muscle can act, muscle can pull. একটা muscle টানতে পারে তো. যখনই whenever there is a compression, especially anteriorly there is a bone compression. এইখানে ডিস্কটা রয়েছে, এটা ধরো ডিস্ক মেনিসকাস, এটা আমার কন্ডাইলস. when there is a compression there is a chance of injury, especially in anterior part. আর কেউ যখনই কম্প্রেশন হচ্ছে, কেউ যদি এটাকে টেনে নেয় তাহলে কি ইনজুরি হবে? if it pulls backwards, the injury, the force, compression force is avoided, so it is not injured. And whenever there is a compression, popliteus pulls the lateral meniscus backwards so that it is avoided from the injury. But no muscle is attached to the medial meniscus. Not only that, it is become rigid by the attachment of the ligament. So medial meniscus is more prone to injury. Medial meniscus is বেশি হয়, lateral meniscus কি হবে না? হতে পারে, rare. তাহলে এটা একটা শিখলাম. This is the lateral collateral ligament. This is the another lateral collateral ligament. আজকে আর ডিটেল যাচ্ছি না, যেটা পড়াবো আজকে যেটা পড়াবো আজকে নতুন জিনিস, বার্সা, রাইট? What is Barsha? Barsha is nothing but a water-filled balloon. মানে ওয়াটার নয়, আমি বোঝানোর জন্য বুঝলাম, জল আপনাদের বেলুন, the hole is coming, so we often fill the balloon with a water, colored water, and throw. So whenever there is a chance of friction between the tendon or sometimes with the muscle with a hard object, suppose this is the tendon, this is the bone, ভালো করে তাকো, whenever there is a continuous action, the tendon may get injured. may damage. So that to prevent it, nature provides water-filled balloon, not water. I'm just to understand you. It is actually a rich, slimy fluid like a egg white. Very few cc, very few milliliter, filled pouch or balloon-like sac is there, and these are called bursa. Whenever there is a chance of friction between the tendons and the bone, between the tendons with the other tendons, দুটো tendon পাশাপাশি যাচ্ছে, there is a chance of friction between the tendons and the muscle. So whatever between the tendons and the ligaments, whatever it may be, when there is a chance of friction, so that tendon getting damaged, the nature provides to prevent the damage what thick fluid filled sac, and these are known as bursa. কি বলে? Bursa. Plural is bursi, B-U-R-S-I. So bursa is usually called synovial bursa, small pouch or sac differentiated out of articular tissues. It is actually made up of collagen fibers or a connective tissue sac. Between tendons, muscles or skin and bony prominences at points of friction. Function is the lubricating device, helps in diminishing friction, allowing free movements of muscle tendon, so that tendon can move freely without any damage. So সবখানে থাকবে? No. Whenever there is a chance of friction, সেইখানেই nature provides, এইখানে দিয়েছে. There is always movements of the shoulder joint, there is a bursa is here. Especially movement, where the movements is more, in and around the joint. So bursa is more present in and around the joint. Bursa sacs are made up of a membrane. বেলুনটা যেরকম একটা মেড আপ অফ এ ইলাস্টিক মেমব্রেন, সিমনি, এবং সেই মেমব্রেনটার নাম কি? সাইনোভিয়াল মেমব্রেন। কি নাম? সাইনোভিয়াল মেমব্রেন। Why nature gives him synovial membrane? Because synovial membrane has got cells which can secrete thick fluid, like a gear oil. গাড়িতে যে গিয়ার অয়েল থাকে, অন্য কোনো মেমব্রেন দিল না কেন? অন্য কোনো মেমব্রেনের ক্যাপাসিটি নেই ওই রকম অয়েল লাইক ফ্লুইড মানে ওখানে প্রিপেয়ার করা। সাইনোভিয়াল মেমব্রেন হ্যাজ গট এ প্রিপেয়ার টিপিক্যাল ফ্লুইড হুইচ হেল্পস in the lubrication. So that bursa is nothing but a synovial membrane covered membrane made up of a sac, made up of a synovial membrane. Within this sac, there is a thick, glary, lubricating fluid. তার জন্য এই বার্সার আরেকটা নাম হচ্ছে synovial bursa. There are different types of bursa: subtendinous, subcutaneous and articular. যখন টেন্ডনের সাথে অন্য টেন্ডনের সাথে স্কিন বা থাকে তখন তাকে বলি সাবটেন্ডিনাস বার্সা। আচ্ছা, এইবারে দেখো, এবারে যেটা ক্লিনিক্যালি কোশ্চেন আসবে সেইখানে আস্তে আস্তে যাচ্ছি আমি, রাইট? এইটা একটা টেন্ডন, এটা হ্যান্ডের কথা বলছি, ট্রাইসেপস টেন্ডন। এখানে যে মাসেল রয়েছে, দেয়ার ইজ এন মাসেল নোন অ্যাজ দ্য ট্রাইসেপস. Always there is a flexion and extension in the elbow joint, so there is a chance of friction. So in between the bones and the tendon of the triceps, there is a field of bursa. Look. Again, between the tendon and the skin, there is a chance of friction, and the bone, there is a bursa. So these are the example of subtendinous bursa. And sometimes bursa is present forming a part of joint known as the articular bursa. এগুলি তোমাদের দরকার নেই, ছেড়ে দাও, ভুলে যাও। এইবারে যেটা আজকের যেটা ইম্পর্টেন্ট, নি জয়েন্টে দেয়ার ইজ এন ফুল অফ বার্সা। 14 বার্সা আছে। তাহলে স্যার 14 বার্সা মনে রাখতে হবে না, অনলি 3টে, ম্যাক্সিমাম 4টে মনে রাখতে হবে। দেয়ার আর 14 বার্সি, স্মল বার্সি প্রেজেন্ট ইন অ্যান্ড অ্যারাউন্ড দ্য নি জয়েন্ট, in the knee joint. But you have to remember only 3, maximum 4. So bursa is present, look, in and around the knee joint. What are the different important bursa? দেখো একটা ছবি দেখাই, অ্যান্টিরিয়ারলি এতগুলি বার্সা, ল্যাটারালি এতগুলি বার্সা, প্লাস মিডিয়ালি এতগুলি বার্সা। মনে রাখা সম্ভব নয়, আমারও মনে থাকবে না। তাহলে আমরা কি মনে রাখবো? মেইনলি অ্যান্টিরিয়ার বার্সা, এই চারটে মনে রাখবো। লিখে নাও, সুপ্রাপ্যাটেলার, সাবকিউটেনিয়াস প্রিপ্যাটেলার, সাবকিউটেনিয়াস ইনফ্রাপ্যাটেলার অ্যান্ড ডিপ ইনফ্রাপ্যাটেলার। কেন দিয়েছে? অলওয়েজ দেয়ার ইজ এ চান্স অফ ফ্রিকশন, সো দেয়ার ইজ এ ড্যামেজ অফ দ্য টেন্ডনস, স্পেশালি দ্য লিগামেন্টাম প্যাটেলি। ওটা যদি ড্যামেজ হয় আমরা এক্সটেন্ডই করতে পারবো না নি জয়েন্ট। সো নেচার গিভস দেম bursae, superficial and deep to the ligamentum patella and also the quadriceps tendon. লিখে নিয়েছো, সুপ্রাপ্যাটেলার, সাবকিউটেনিয়াস, প্রিপ্যাটেলার। প্রি মানে কি? আগে, ইন ফ্রন্ট। সাবকিউটেনিয়াস ইনফ্রাপ্যাটেলার, ইনফ্রা মানে কি? বিলো, বিলো। আর ডিপ ইনফ্রাপ্যাটেলার, তার মানে কি সাবকিউটেনিয়াসও আছে, একটা সুপারফিশিয়ালি রয়েছে, একটা ডিপ রয়েছে। ছবিটা দেখাই, এইটা হচ্ছে প্যাটেলার সামনে, দিস ইজ দ্য প্যাটেলা, রাইট? আমার আছে কিনা? This is the patella, and in front of the patella there is an bursa, violet color, between the skin and the patella, just in front of the patella, just below the skin, deep to the skin, so we call it subcutaneous. So this is known as the, খুব ভালো করে দেখো, subcutaneous prepatellar bursa। কি বলে? Subcutaneous prepatellar bursa. Similarly, there is an bursa between the skin and the ligamentum patelli. This is the ligamentum patelli, the white one, and this is the bursa between the skin and the ligamentum patelli, and it is below the patella. So we call it subcutaneous infrapatellar bursa. And at the more or less at the same level, between the ligamentum patelli and the bone, tibial tuberosity, there is another bursa. So we call it deep infrapatellar bursa, as it is deep to the previous one. And there is another bursa here known as suprapatellar bursa, which communicates with the joint cavity. এই চারটে মনে রাখতে কি খুব অসুবিধা হবে? না, বাস। অ্যান্ড আরেকটা মনে রাখবে, জাস্ট নামটা মনে রাখবে, ancillary bursa. আমরা জানি medial surface of the tibia, upper part, there is an insertion of the muscles, sartorius, gracilis and semi-tendinosus, right? And there is an bursa covering the lower part of this, all this muscle, and we call it ancillary bursa. লাল দিয়ে লিখেছি। Now applied part, the last part. If this bursa is a full of fluid and there is a chance of infection, হতেই পারে, just স্কিনের নিচে রয়েছে constant, and sometimes bacteria may get there, or due to repeated there is a chance of infection. And whenever there is an infection, the part swelled up, there is an pain, there is an redness, and we call it inflammation. You will better know when we go to the second year, known as the pathology, color, dolor, rubor, tumor. So there is an swelling, there is an color change, become red as more blood coming out. There is an dolor, dolor means pain is there, and tumor, tumor means swelling. So the inflamed part, whatever may be the hair, whatever may be, there is an boil here, boil মানে ফোড়া যদি হয়, there is an swelling, redness, pain, so we call it inflammation. And usually whenever there is an inflammation or infection, we call it itis. Means when appendix is inflamed, we call it appendicitis. When gallbladder is inflamed, we call it cholecystitis. There is a sinus in our paranasal sinus. When it is inflamed, we call it sinusitis. Right? Similarly, when bursa is inflamed, we call it bursitis. We call it bursitis. Now look, this prepatellar bursa, sometimes inflamed, becomes swollen. Look, this one. বুঝতে পারছো এটা নর্মাল, এখানে there is a swelling and we call it prepatellar bursitis. কাদের বেশি হয়? হ্যাঁ, যারা ছবিটা কোথায় গেল? এই দেখো, হাউসমেটস যারা এরকম ভাবে বসে করে, the prepatelar part always in constant friction along the hard floor, always ঘষা খাচ্ছে, and there is a chance of inflammation, formation of itis, bursitis. So there is a swelling of the prepatellar bursa. We call it prepatellar bursitis, or in common word, housemate's knee. Housemate's knee. There is an inflammation of the subcutaneous prepatellar bursa known as the housemate's knee. Right? এই দেখো, তাহলে কি শুধু মেয়েদের হয়? Only female? No. It can occur in male also if you do such type of work. So this is an example of housemate's knee, but still the name goes housemate's knee. So better avoid the housemate's knee term, call it medical term prepatellar bursitis. There is another thing, clergyman's knee. Clergyman's mean ki? Bishop, churches jara bishop, they usually prayer in this fashion. Look, this is the patella. This is the patella, and there is a swelling here. This is the bursitis. Which bursa is involved? Subcutaneous infrapatellar bursa. Why it is important? Because there is an repeated this type of posture. Usually the clergyman, the bishop of a church, prayer days after days by this fashion, and there is a chance of friction of the lower part of the patella with the floor. So there is an inflammation of the maybe. বলো, হ্যাঁ বলো, এদিকে হ্যাঁ এদিকে আসুন, আসুন, ভয়ের কিছু নেই, এদিকে কি বলছো? তুমি চাইছো তোমার হোক নাকি? হতেই পারে, চাইল্ডকে ঘষা দাও অনবরত, ইউজুয়ালি হয়, কিন্তু দ্য বার্সা ইজ নট সো ওয়েল ডেভেলপড দেন, সুতরাং ইনফ্লামেশনের চান্স কম। খুব ভালো প্রশ্ন করেছে। চাইল্ডের হতে পারে না? হতে পারে, নিশ্চয়ই পারে, কিন্তু হামাগুড়ি দিলে অনবরত চেঞ্জ অফ পশ্চার হচ্ছে, কিন্তু হতে পারে। বাট ইন চিলড্রেন দেয়ার ইজ অ্যান ভেরি গুড কোশ্চেন, আমারও মনে আসেনি এটা। হ্যাঁ, দিস ইজ দ্য ডেভেলপ অফ অ্যানালিটিক্যাল রিজনিং। আমি আজকে টিচার্স ট্রেনিং আমরা হচ্ছে একটা, জানো, ওখানে আমি এটাই বলেছি, অ্যানালিটিক্যাল রিজনিং। হ্যাঁ, এই যে আমি বললাম ওর মধ্যে একটা অ্যানালিসিস যোগ করলো, চাইল্ডেরও হতে পারে, বাট রেয়ার, বিকজ চাইল্ডে বার্সাটাই ভালো ডেভেলপ করে না। যদি ডেভেলপই না করে, ওখানে ইনফ্লামেশন হবে কোথায়? রাইট? ভেরি গুড, খুব খুশি হলাম আজকে, রিয়েলি আই এম থ্যাঙ্কফুল টু ইউ। Though I am teaches more or less in every college. In my government service life, I used to teach in every college, but really you are very good students. Such type of question and such type of interaction, I really feel. So thank you very much. I am really gets energy. So this is the difference. So this is the difference. তাহলে ক্লিয়ার হচ্ছে? এটা কিন্তু এখন নট অনলি রিমেম্বার দিস, রিমেম্বার থ্রু আউট ইউর লাইফ when you do practice. Because the normal treatment is rest, avoid the posture, ice packing, ice posture. Don't give hot compress. আমাদের ইউজুয়াল আছে যখনই ইনফ্লামেশন হয় গরম শেক দাও, বাট as there is an inflammation, it will lead more and more fluid come due to heat. So better to give ice pack. Whenever there is a swelling, you don't ask any patient to give heat compress. After that, when it swell, become chronic, then you give. But acute condition, when patient come with acute pain, don't give hot compress anywhere. Ask them just opposite, give ice pack. And you give some anti-inflammatory drug, antibiotic. If does not cure, then we go for incising the bacteria. Then you go to surgical procedure. তো বার্সাটাকে ফ্লুইড বার করে দিয়ে দিতে হবে। এই যে এইখানটায় থাকে অ্যানসেরিন বার্সা, এইখানে তিনটে টেন্ডন, সার্টোরিয়াস, গ্রেসিলিস, সেমিটেন্ডিনোসাস, এই যে তিনটে টেন্ডন, medial surface, and just below it this is a Anserian bursa. এই যে তিনটে টেন্ডন, it is cut, sartorius, gracilis and bursa is seen. এটাকে টেন্ডনটাকে কাটা হয়েছে, কিন্তু দেখতে পাচ্ছ কি the tendons are cut to expose the bursa.